Welcome back, friends. I am Dr. Vijay Shekhar, a pediatrician. Today, with the imminent onset of monsoon, let us discuss a few things which might be immense importance to you. We have been hearing that Aedes mosquitoes are rapidly multiplying from our entomology departments, and it is possible that dengue might come back in a big way. So let's first discuss dengue fever. It's a dangerous disease. It's eminently preventable. It happens only through mosquitoes. So what you need to do is every week in your colony, make sure that you have emptied all water remnants which are collected in the pots or any tires or anything that can have some stagnant water and breed mosquitoes. These mosquitoes don't travel beyond 150 to 300 meters. So if your entire colony does this once a week, you can be sure that you can keep your residential area free of Aedes mosquitoes and thus also the scourge of dengue fever. The other important part would be wearing full clothes when you're going out, taking anti-mosquito measures, using repellents, especially in the early onset of monsoon when the risk is highest. If somebody does get dengue fever, please report it to the authorities so that they'll take up spraying campaigns to decrease the mosquito breeding. Dengue per se is best avoided, but if it does happen, contact your doctor. They will take care. Don't panic and rush for blood and blood products. It may not be necessary most of the time. Most of the time, it will decrease once the fever decreases. A very few people, a small percentage will go into complications which will be dealt with appropriately by your pediatrician. The other aspect that I would like to touch upon today is, with the onset of the monsoon, you are expecting a surge of viral infections, probably influenza. So if you are not vaccinated against influenza, this might be the right time to take your annual influenza shot, especially those children who are prone to wheezing attacks or recurrent respiratory infections. Also, people who are immunocompromised for any other reason. Please look out for signs of respiratory infection in your children and avoid their mingling with other children so that you do not spread it out. Avoid school when your child is having respiratory infections because it's easily spread that way. Also, try to avoid at the onset of the monsoon cold things like ice creams, cool drinks, eating out. This might spread both the respiratory disorders and gastrointestinal disorders. Have a good monsoon. Enjoy your time. Thank you.